Welcome, everybody. Today's August 17th. This is the Makah EOC public briefing. We'll go ahead and get started with Dr. Cope's report.
Okay, good morning, everyone. Sorry, my computer is a little slow and internet has been hard all day, so I apologize in advance if my audio is coming across kind of wonky, but we will get through this. Okay. Is my slide presentation up? Can you guys see?
Yes, Dr. Cope, sounds good too.
Okay, great, thank you. All right. Well, good morning. Thank you, everyone, for joining the call. We've got, at this time, 15 active cases of COVID. We have a number of patients, thankfully, who have recovered. So that number has gone down. It was 19 at its all-time high for one day. We had 21 active cases we were managing, but just very thankful that folks are starting to recover. For everyone's information on the phone, recovery from the COVID virus is defined not by a negative test, but by resolution of symptoms. And if they are not symptomatic, then we do every 14 days. So either 14 days from the date that they tested positive, or 3 days after they've had no symptoms without using medication to resolve those symptoms. So whichever is shorter. So at least 14 days. And then if they have symptoms beyond that, they'll be recovered 3 days after those symptoms are gone. So I just wanted to make sure that's clear, because sometimes people have asked about if they test negative or what. It's not based on the test. It's based on resolution of symptoms in a minimum of 14 days. So that said, we still have 15 active cases. A number of those, as long as they continue to not have symptoms or continue to resolve their symptoms, will recover over the next week. 6 of those cases are breakthrough cases. Those are individuals who had been fully vaccinated and still contracted the virus. Sorry, it's telling that somebody's in the waiting room, but I don't have a button where I can let them in the waiting room. Does anyone else have that? I might not be able to. Okay, I'm just going to continue, and my apologies for anyone who's waiting in the waiting room right now. There's just no button for me to let them in. Okay, we have had 33 cases total. This does not include any of our non-residents who have just informed us when they were working here that they later tested positive. It's just those who are residents here or who we diagnosed here in Neah Bay. We have 8 total households and 27 individuals in official quarantine. All right, so this is just a chart to show over the course of the entire pandemic since March 2020, which is when things really started to be on our radar, how many cases of COVID we've had. So clearly there's been a significant increase just in the month of August. This was updated August 16th. Sorry, I didn't update the title there, but we have had significantly more cases just in the month of August. And this shows just our rate of new COVID cases in the last 2 weeks. So updated yesterday, just shows kind of this pretty steady pattern, although over the last couple of days, we've not had any cases. So it does seem to be decreasing right now. And also over the last several days, all of our cases have been in households that were already in quarantine. Some of our major efforts in the last week have been case and contact tracing, isolation, and quarantine. We have, until several of those households came off of quarantine, we had 4 times as many households than we've ever had before. So certainly a major effort on the community's end to support those who are in quarantine and make sure they have everything that they need and just are motivated to stay home. We've also done several mass COVID testing and vaccine drive-throughs and including over 400 tests, which is great. We have to keep testing so that we can catch it. All right, so I showed this chart last week about how things are spreading in Neah Bay. And then I've added a couple of the newer cases that we got. And many of them are cases that were already on this chart. So I've turned from red to black any of the projected individuals who were possible might become positives. And then we still have these other individuals who are at risk of becoming positive simply by being in the same household with somebody who has COVID. These individuals are all in quarantine or the isolation is used when somebody actually has COVID, and quarantine is when you've been exposed. But these individuals are at much higher risk because they're quarantining with somebody who is positive for COVID. So we can anticipate now possibly 12 new cases if all of these household members turn positive. I know that many of these households are taking measures to reduce exposure, and then some have relocated to a cabin or isolated themselves. We don't separate parents from children for sure. So there's no forced separation of families at all. I just want to be real clear that we don't do that. All right, so Clallam County is also high risk, and my apologies, this data is actually for August 16th. So high risk, still up in the 9s and 10s for their percent positive. Over the weekend, they had got 5 new admits into the hospital, which is a lot for a pretty small hospital. So got a lot of COVID cases in the hospital, and then unfortunately had 1 new fatality. And you'll see on the chart that their rate per 100,000 has gone way up. So I'll go ahead and show that. So this is what it was last week. So this is just a visual of new cases per 100,000. And I just wanted you all to see what it was last week. And then we're going to fast forward to this week. As you can see, the scale on the left had to go up another 100 to show, and even this data is lagged. So we are all the way up here in Clallam County. Same with Washington State. They were well on their way up a couple of weeks ago, and now up here in the 300, near 370 cases. And then for the United States, the story and the picture is unfortunately much the same. This new reported cases, and then what we see is hospitalizations lag about 2 to 3 weeks after a rise in new cases. And then deaths unfortunately follow that. So right now, well, this number, it was over 100% for a while. Now it's kind of starting to taper off. It's still increasing for sure, but not at as high of a rate. This number is now starting to go up, and then the rate of new deaths per 100,000 is increasing rapidly. And unfortunately, it's anticipated that it will, at least for Washington State, reach the same level of highs that we had at the worst part of the pandemic last fall. This variance of concern chart, we get this data once a week, and it is updated, but we know for sure that it is a little bit out of date, but it does show the Delta cases are obviously increasing quite rapidly. Whereas the alpha cases, which were quite predominant a couple of months ago, are not increasing at as fast of a pace, but the labs for the state cannot keep up with the demand right now. We know that this number is much higher. In fact, one of our cases is a confirmed Delta case, and that hasn't been reflected in this data yet. But what we can see is this rate is certainly outpacing any of the other variants. A couple more slides just to talk about the Makah COVID-19 public health protocols. So currently we're in phase 1, which is a component of section 6 of Health Order 0521, which the council can use when we have an increase in cases. So phase 1 just means staying home except for essential and safe activities. All public and private gatherings are prohibited, and non-essential businesses may be open with an approved workplace safety plan. Traveling protocols stay the same regardless of what phase we're in, and that's because high risk areas exist certainly regardless of what is going on here. But they were updated to show that because we know the increased transmission of Delta and the spikes going on everywhere, any Neah Bay resident who travels and has close contact with anyone outside of their household group needs to go into a preventive quarantine. And that means staying at home except for essential and safe activities, which is exactly the same as phase one, but being certainly extra strict about it. Absolutely no socializing outside of the household group or taking any risks with not wearing masks, et cetera. And what I do want to highlight here too, just some statistics that air travel is absolutely not recommended right now, especially for unvaccinated individuals. It's estimated I think I got muted there for a second.
Yeah, we lost you right at air travel, your notification for air travel.
Weird. And am I no longer is it still recording somewhere?
It's recording. Sorry, I was letting somebody in the room and it clicked on yours.
Okay, that's okay. All right. Sorry, I just saw a question in the chat. I'll get to that question shortly, Denise. Thank you. As far as traveling, so air travel, statistically, if you're on a flight with 200 people, at least one of them has COVID right now. So taking off your mask to eat or drink, which is where we're seeing transmission on flights, is obviously not recommended. And then certainly anyone, if you're vaccinated and you have to travel by plane, just keep that mask on and try not to, I know that's kind of impossible to ask, but try to find ways to hydrate and eat before the flight and after. If you're unvaccinated, it is strongly recommended to not get on an airplane at all right now. The other statistics that are out there is really if you go into a indoor public space where there are other humans and you're unvaccinated and you don't have a mask, it is very possible that you could get COVID. So that's just what we're seeing based on transmission and where people are getting it. Okay, so question, I presented this slide last week and just want to hit it again. Is the COVID-19 vaccine still effective if we have so many people who are still getting it? And the answer is yes, it's absolutely effective. And this spike is 100% driven by unvaccinated individuals. So this, I'm certainly can't really make guarantees or confirmation, but we are certain, epidemiologists and health officials everywhere are certain that this kind of spike is being driven by unvaccinated individuals who are not following the public health protocols. To be fair, there are certainly unvaccinated individuals who are following the protocols, but those who are not, who are participating in gatherings, et cetera, and traveling are the drivers of this. And we actually here in Neah Bay haven't seen any vaccinated individuals, fully vaccinated individuals transmit it. That is possible, but we haven't seen that quite yet. What this chart shows is that for every 102,000 vaccinated individuals, there are only 100 symptomatic breakthrough infections. There could be more that are asymptomatic, but only 100 that are symptomatic and only one death. And that is certainly something that should be, I hope, meaningful and motivating because we have certainly less than that population here in Neah Bay, and we can prevent that by getting as vaccinated as possible. Of course, our kids can't get vaccinated, which is something I do want to call a lot of attention to and don't want it to be a blind spot for us. On that note, we have all 3 vaccines available and we are doing regular vaccine clinics when we do our COVID testing every day. So, and if those hours don't work, 1 to 3, Monday through Friday, then call us and schedule an appointment and we will get you in. We are not doing booster vaccines yet. So the CDC has approved them for a very, very small, limited number of specifically immunocompromised individuals. And those are people who are immunocompromised because of cancer treatment or other medical treatment or untreated HIV, for example. It does sound like they're going to approve it for a much broader group very soon, but we're gonna reach out to that very small population now, and then we are going to plan a much bigger vaccine effort for when that booster, that third shot becomes available. All right. And I didn't have time to put a slide together on this, but I did want to update our vaccine rates. We have seen, this is encouraging news, we have seen an increase in individuals coming in for the first dose of the COVID vaccines. So we went up, our fully vaccinated rate went up almost a full percent to 73% of everyone 12 and up in Neah Bay. And then our first dose, or single dose, went up also about 1% to 79% just in the last week. So we have 79% of our residents here who are 12 and up have had at least one dose of the COVID vaccine, which is, again, very encouraging. All right, I'm going to look at these. I do not have, the question is, do you have current data on hospital bed ICU capacity in Collin County? I don't. What I have is hospital bed ICU capacity in the Northwest region, which includes Jefferson County and Mason County. And the data was, when I last checked, it showed that we were actually meeting goals, being less than 80% at capacity. But I know for sure that that has probably changed given the weekend statistics, and most likely is not meeting threshold or goals. And then Denise said that someone with over 16 years with an airplane maker, she fully agrees with the airplane warnings, which is great. And then we have info on mixing vaccines or spreading them further apart, if Canada did. I do not have any info on that right now. All right.
All right. Well, thank you. Thank you for the update, Dr. Cope. Appreciate you taking time to answer the questions that were posed in the chat. We'll go ahead and move on. As far as the Makah Tribe organization, there's no updates at this time on the Makah EOC. The update is just reminders that we are still in phase 1. The EOC will review that on Thursday at our normal meeting. I wanted to thank everybody and the community's participation for the decrease in travel outbound and inbound to the reservation during this time. Thank you all. I appreciate your efforts. Wanted everybody to wear your mask, vaccinated or not, and they will be mandated in all tribal buildings upon reopening. Just another reminder, be safe when traveling. For essential needs, take the proper safety precautions and safety measures. We will also be posting this bulletin or update on the stick.org website, along with our traffic information with the most recent data that we have. Any other questions at this time? So I don't see any posted in the chat, so I want to thank everybody. Another notice is that there will be food boxes available today upon delivery at the Warm House. We're shooting for a 1:30 distribution this afternoon, but we will be also sending out a regroup message to everybody who is online to get that notice out to the community. So those will be available, and we will call it a day. So I want to thank everybody for their participation. Thank you to the Makah EOC, Stick EOC, Stick staff, and also to the Makah Tribal Council. Thank you guys. Appreciate all the work you're doing, and stay safe, and we'll see you next week. So thank you.